Hello, and thank you for joining us on LAPL's YouTube for another mental health series here with us. And we are honored here today to have Dr. Cochran with us on the topic of anxiety and social isolation in a post pandemic era with practical strategies for children and adolescents. Dr. Lara Cochran, PhD, is a licensed psychologist with 25 years of experience working with collaboratively with individuals, helping them overcome challenges in life that can quietly spiral into depression and anxiety. Her areas of expertise are trauma and anxiety disorders, as well as depression and disorders of childhood and adolescence. Thank you, Dr. Cochran, for accepting our invitation here, and we are very excited to listen to your presentation. Thank you.
Uh, I am very happy to be here today. And I just want to check here because, oh, there's the slides. Okay, great. This is a topic that I feel very strongly about and have dealt with a lot in my career. And I am really happy to have everybody here joining me either live or on your own. And so let's begin. So today, as Roya mentioned, we're going to be talking about anxiety and social isolation in a post-pandemic era. And we're going to start off by talking just a little bit about what is anxiety. So, when we think about anxiety, we can go back to like the caveman times. We could look at the caveman or woman who's going out to hunt for their food, and they're then confronted with a very large animal that they have to defeat and bring back for dinner. And so at that moment, when the cave person is confronted with this animal, there is that automatic response physiologically of fight or flight. Now, what does that mean? I'm sure many of you have heard this before, fight or flight. It means I'm either going to subdue this animal, or I'm gonna get out of here because I'm not going to be able to subdue the animal, and I'm going to get killed. So this fight or flight response, we all have it, and depending upon the situation, we may respond differently. So this also relates very much to our nervous system. And so what does that look like here? So when we talk about fight or flight, there's two systems that are involved. There's the sympathetic nervous system and the parasympathetic nervous system. Now, the sympathetic nervous system is the system that causes it alerts us. Oh my goodness, there's a very large animal that's going to kill me. I have to either kill the animal or I have to run away. That's the fight or flight, right? So what do we notice in our bodies? Our heart starts to race a little bit, and our breath becomes more shallow. We may notice sweaty palms, and that's the anxiety. That is the alerting part of the system. And actually, it's a good thing. Because a lot of times in life, we want to know when there is danger out there. We want to be alerted about it so we know how to respond. But it's really important for our talk today to know that this is a normal biological process that happens. Now, the parasympathetic nervous system is that part of the nervous system that calms you down. So, you may notice in my background, there's a candle in the back. That is kind of like a calming thing. Sometimes you can have essential oils. You can focus on your breathing. But when you're in a stressful situation and the situation has passed, your parasympathetic nervous system kicks in and things are sort of back to a normal state. Now, when you're talking about individuals who have significant issues with anxiety, this system is a little bit out of whack. So kids that have anxiety disorders, teens that have significant problems with anxiety, you're going to notice that the sympathetic nervous system is on overdrive. They're never able to quite calm themselves back down. So I just want everybody to keep in mind those two aspects to it, both the fight or flight, and then also the relationship between the sympathetic nervous system and the parasympathetic nervous system as we move on and talk a little bit about anxiety in children and adolescents, because that is what we're here to talk about today. Okay, so let's talk about kids. So one of the things that's really important to know about kids is that they don't have the language skills necessarily to be able to tell somebody when they're feeling anxious or when they're feeling worried or upset about something. And not only do they not necessarily have the language skills, they also may not even know that that is what they're experiencing. So many times what will happen with a kid is that they will, they know that something's wrong, but they don't really know what it is. And they can't necessarily tell you as the parent or caregiver what is happening. So it's important just to be thinking about that, because mostly what we see in kids is behavioral issues. That is how they're presenting the anxieties with their behavior. They're not necessarily telling you what that is. And I just want to look at my notes here for a sec, because I want to make sure I'm not missing anything. And then for the purposes of this talk, when we talk about kids, really what we're talking about is under the age of 12. So we're talking about preschoolers, we're talking about elementary school age kids, we're talking about the very, very, very young middle schoolers. That is the time frame that we're referencing here in terms of talking about anxiety in children. And I think the other thing that is important to note, because I forgot to mention it earlier, is that when you are anxious, whether you're a child, a teen, or an adult, there is no rational thought that happens at that point in time. You're really not able to rationalize what your experience is. But let's move on and talk a little bit about what we're seeing in kids. Okay, so avoidance, that's a biggie. So we're going back now to talking about that fight or flight, right? So the avoidance is the flight. Whatever the stressful event is or the anxiety provoking event, kids tend to just avoid. So what are they avoiding? They are avoiding social contact. They're avoiding family contact. They're avoiding activity outside of the home. They might be avoiding things that typically make them happy because there's some anxiety related to it. But there is an avoidance. Sometimes, you see this even on the playground. You see kids who are scared to get on the swings, or kids who are afraid to climb the monkey bars. There's a fear there. So what else are we seeing here? We see irritability and reactivity. That is their way of letting you as the parent know something isn't right here. We also see a lot of nighttime fears. So what does this take the form of? It could be nightmares. It could be kids being afraid to sleep in their own bed at night and want to sleep with mom and dad. It could be fear of the dark. It could also be just kids, they go to sleep fine, and then in the middle of the night, they wake up and it's dark and they're scared. So nighttime fears is definitely a symptom of anxiety that we see. Also, bedwetting, that is something that can happen with anxiety. Let's say you have a child who normally they had no issue with potty training, and they're in elementary school now, and every time they go over to a friend's house, they wet the bed. So there's some anxiety there. That's another thing. One of the other concerns that we see with kids is physical concerns. So what this takes the form of is stomach aches, nausea, vomiting, diarrhea. These are kids, they know that there's something wrong. They know that there's something that just isn't right. And they're able to say, oh, I have a stomach ache today. I don't want to go to school. Or, oh, I'm really nauseous. I don't think I can go to that baseball game. So that's the physical concern. And then another area that we see is poor school performance. And I think it's important to note here, because I am going to talk more specifically about it when we talk about COVID, that a lot of the poor school performance for the anxious kids is about difficulties with attention and concentration. Then we have tics. Now traditionally when we think about tics, people will say, oh, well, that happens in Tourette syndrome. But it also really just happens in all kids. And it happens specifically with kids that have anxiety. And it could be things like eye blinking or a motor tic, like it could be a facial tic. But typically with anxiety, it passes. It's not something that is substantial or lasts for a long period of time. Also, we tend to see a little bit more of the self-soothing behaviors, like the nail biting, skin picking. Sometimes kids will do this thing where they'll take their t-shirt and they'll suck on their t-shirt. And this is all related to having to manage their environment. And the feelings and emotions that come up when they're not able to do that necessarily. So I just want to make a moment here. If there is anybody that has a question, or if there is anything that people want to know more about or have a question about it, that they can certainly do that at this point in time. And if not, I'm just going to continue to move on with the talk. So you can pick up with that at a later point in time. Let's move on and talk a little bit about what anxiety looks like in teenagers. Because obviously we're going to go back and talk about how to treat it and the circumstances of COVID. But now that we've talked about kids, let's move on and talk a little bit about what anxiety looks like in teenagers. And so at this point in time, we're looking at how are teens different than children? Well, one of the things that we can say about teenagers is that they do have the language to be able to tell you when something is bothering them, but they may not necessarily choose to tell you that. They may feel like either they're ashamed or they're shy, or that they're not going to let you know as a parent that something is bothering them, even though they have the skills and the ability for that pragmatic speech to be able to tell you what's going on. So in terms of symptoms and behaviors, one of the things that we see very much like kids is avoidance of things, avoidance of people, avoidance of places. And it could be a temporary avoidance, or it could be to the point where kids just aren't even leaving their room. And this is something that has been very common, and we've seen a lot of this post-pandemic. I'm going to talk more about that, but avoidance is one of the primary symptoms that we do see in teenagers. Also, poor attention and concentration. Now, it's important to note here that, with the attention and concentration, it may not just be anxiety. Sometimes kids have other issues that are impairing their ability to function. And it could be a learning disability. It could be they didn't sleep well the night before. It could be, some other issue that isn't necessarily anxiety. But we do see this with anxiety. And I want to just kind of put it in a context for you a little bit to say that if you have if you have a teenager that has experienced a traumatic event in their life, they may end up in the classroom thinking about that traumatic event. And so if they're in the classroom and they're not able to focus on the teacher and what's happening and learning the material, it is in fact because they are thinking about that thing that happened that is making them feel bad. So I think you have kind of like a double effect here too, because in these circumstances, not only is the teen feeling badly because of the traumatic event, but then they're also not doing well in school and they're feeling badly about that. So that's where you get some of those depressive symptoms coming in as well. So we talked about attention and concentration. We talked a little bit about avoidance. Also, overeating, undereating. Now, what does this look like? Overeating, teens using food as a coping mechanism because they're anxious about peer rejection or something happened, with a boyfriend, girlfriend, or there's some cyberbullying or some other issue that is going on in their life. And so they're using food as a crutch. Undereating, kids have the physiological experience of nausea, possibly vomiting, and therefore they're not hungry. So that can happen as well. Two other things related to the food issue to think about are, one, there are some children and adolescents who also have, kind of like a food avoidance, meaning that they are anxious about, they're just certain foods they don't want to eat. And they will avoid those foods, and the anxiety will present itself when they're in a situation where they have to eat that food. Also, we do have eating disorders, and eating disorders is not really something that we're going to talk specifically about today in this discussion, but it is something that can lead to or can be a source of why kids are not eating. But in the context of our current conversation, overeating, undereating is a symptom of the anxiety. We talked about the physical concerns. We have not talked as much about sleep disturbance in teens. This is kind of a conundrum here because, with teens, you have a situation where there, in most cases, is an excessive social media influence or internet influence. So kids are on their phone late at night, kids are on the internet late at night, which contributes to sleep disturbance. How it used to be before the internet, it was you would, if you were a kid, at the end of the evening, you would lay down at night and you'd worry about all those things that you had to worry about for the next day, which would contribute to the sleep problems. Now, kids are Googling it, or they're going on the internet and they're looking at TikToks about it. And that is also contributing to sleep problems. Now, sleep disturbance in adults is really prominent with anxiety disorders. So with teens, we see quite a bit of this. And then in the morning, there's a certain grogginess and an irritability as well that happens. I mentioned before the attention and concentration problems leading to poor school performance, but I think it bears repeating that a lot of times kids are not doing well in school because they're just having difficulties focusing. They're really not able to retain the information. Another issue that is really prominent in the teen population is school refusal. Now, what does this mean, school refusal? This is basically kids that just won't go to school. These are high schoolers or middle schoolers that say, no, I'm just not going today. And they just perpetually are not going to school. And it's a real issue. Now, school refusal in the context of anxiety is children, or teens that there's some feared event, there's some issue that they are avoiding by not going to school. And it could be an issue related to bullying. It could be an issue related to challenges in getting work done. It could be something related to a teacher. But regardless, school refusal is a big issue that we're dealing with anxiety. And lastly, alcohol and substance abuse issues. Now, I'm not going to talk extensively about that today, especially since it's, we have such limited amount of time, but I am just going to make the note that teens that are experimenting with alcohol and substances is one thing, And then when you have a teen who has anxiety and distress, oftentimes the alcohol or the substance becomes a self-medication. So kids that are vaping, kids that are smoking marijuana on a daily basis, these are individuals that may be using the substance in their mind to help calm them down, even though actually it's doing the opposite. So before I move on and talk a little bit about COVID, I just want to make sure, again, that there aren't any questions or that, oh no, I lost everybody. Okay. That there aren't any questions or anything that in the chat here. Let me just make sure that there isn't anything here. Okay. I think we are good. Anyway, let us move on and talk a little bit about COVID. Okay, so part of the reason why I wanted to do this talk to begin with is because my sense is that COVID had a tremendous impact on the children and teens, at least here in the United States. And one of the things that I just want to remind people of is that COVID started at the beginning of 2020. It was around March that the kids were sent home from school and basically were online schooled for at least a year, maybe a year and a half for some people. This was a huge trauma. This is a trauma that we all experienced by having the impact of COVID. There was a loss of family members. There was, could be a loss of friends. There were individuals that completely lost their jobs. Whatever they were doing work-wise became obsolete when we were on lockdown. People were scared of getting COVID and of dying. There were a lot of conflicts around vaccination and around masking. There were kids specifically who were bullied either for wearing masks or for not wearing masks. There were kids that were bullied for being vaccinated or for not being vaccinated. And I think it's particularly important to remember that these kids that were schooled online lost critical developmental time periods. So for example, let's say you have a kid that COVID began in middle school, so they're just starting 6th grade. That is a time period when they would normally be forming their peer groups, making those connections, starting to identify who they are as an individual, and they're doing it all online. They're doing it 100% online. These are kids that many of them were not able to respond well to online learning. We know that kids with learning disabilities did not do well with online learning. We know kids with ADHD and other neurological issues don't do well with online learning. And in fact, research seems to suggest that all kids, at least in the state of California, are behind at least 6 months in mathematics as a result of COVID. So we know that COVID had a huge impact. And I'd like to now talk a little bit more specifically about what we see in the kids and the teens. So we know, for example, that, we know, for example, that there was increased social media and online socialization. And part of the reason for this is that became, when kids started to first understand how to form their peer groups, they were doing it online. And so for them to all of a sudden decide, well, I'm going to go meet people in person, it's a little bit more alien for them. So we're noticing the increased social media, the increased online socialization, and a decreased wish to socialize in person. Now, part of the reason I believe that is because there was a time period where these kids were worried about COVID. They were worried about getting COVID. I also think that part of the reason is that they just didn't have the skills to socialize in person, and so that increased the anxiety. So this was a big impact on this population. Also, we see avoidance of trying new things, avoidance of going places outside the home. As I mentioned earlier, we're seeing the kids are behind in academics, leading to increased anxiety and stress about grades. We're also seeing in the older teens an avoidance of travel or leaving home. So if you can imagine back in 2020, when that population of teens was graduating, they didn't have prom, they maybe didn't even have homecoming, and they weren't able to graduate in person. And these kids took gap years. Many of them didn't go to college that first year. They weren't able to go to community college in person, so everything was online. And so these kids decided to stay home. And many of them have since said, I don't want to go to school far away. I want to go to school near my family. Some of these kids have lost significant relatives and they don't want to take the risk of being far away. Also, it goes without saying that grief and loss really looms large. So as I mentioned earlier, some of these kids have lost significant parts of their family. And so that grief and loss is a process and impacts them, not only in terms of anxiety, but also in terms of depression. The anxiety being the fear around COVID or fear around contracting the disease. So moving on, let's talk a little bit about what to do. So I want to go back here to the first slide where we talked a little bit about fight or flight, and then we talked about the sympathetic nervous system and the parasympathetic nervous system and how they work in conjunction with one another. It's important to note that the sympathetic nervous system, it's our alert system. It's what helps us to know that something is wrong. So when you have anxiety and it is perpetual or it's continuing too much, there are things that we can do. And I'm going to go over some of these practical strategies with you guys. And I'm going to make sure to talk a little bit about the strategies. And then we're going to move on and talk about specific strategies for social isolation. And then we're going to talk a little bit about when to seek out help. So let's start with the what to do. So the very first thing I would say is important with this population is to talk. And why is talking important? When you talk to another person about things that are bothering you, you're actually processing that experience. And this is true for both teens and for kids. But I think specifically with children, because they don't have the language skills necessarily, you as the parent or caregiver can help them to put words to their experience. So when you have a kid that is avoiding going to school, or you have a kid that is scared to go to the doctor, being able to sit there and hold your child's hand and ask them, what's happening? What is it that's bothering you? Helping them to put words to it really actually helps quite a bit. Also, I think what talking can do is it can normalize the experience for the kid. So they may not let you know that they are understanding what you're saying, but it does make them feel better when you normalize that experience for them. Now, one of the common strategies for anxiety is gradual exposure to the feared event combined with relaxation. Now, what do I mean by gradual exposure? Gradual exposure is, if you take, for example, a child that, let's say, has a fear of snakes, and anytime they see a snake in person or they see a snake on the television, they run into the other room, and there's, the sympathetic nervous system, the heavy breathing, and, the heart rate increasing. Gradual exposure would be showing them pictures of the snake, showing them smaller pictures of the snake, looking at a snake in at the zoo, and then eventually putting them in a situation where they're holding, onto a snake that is trained and is non-poisonous. That's the gradual exposure piece. What goes along with it is the relaxation. Now, when we talk about relaxation, we're talking about several different things. The very first thing we're talking about is breathing. And when I mention focusing on your breathing, it is taking a deep cleansing breath, just that. You take a very deep breath in, you hold it at the top, and then you let it go. Focusing on your breathing with the children makes a huge difference. Now, you don't take 1 or 2 breaths. You don't take 5 or 10 breaths. You're pretty much breathing, I want to say, for a good 5 minutes, maybe 10. The idea is to help kids to learn how to focus on their breath, to take the time to sit there and breathe when the anxiety presents itself. You can do that with them on the floor. There are visualization exercises for the younger kids. You can imagine like blowing out a candle. There are apps on the phone, like in the Calm app, where you can actually see the breath going big and getting smaller again. All these things can help kids to focus on their breathing. So again, gradual exposure in conjunction with focusing on your breathing. And then there's another piece to this, which is what we call progressive muscle relaxation. Now, what is progressive muscle relaxation? Progressive muscle relaxation is you're taking the different parts of your body and you're tensing them and you're releasing them. The experience is very much like if you were to go get a massage, or if you were to go to a yoga class, or if somebody was just to give you a nice shoulder massage. All of a sudden you're tensing your muscles and then you're releasing them. You're tensing your muscles and then you're releasing it. And you're going throughout your body, every single muscle, tensing and releasing that muscle. There are guided meditations for that as well, for the progressive muscle relaxation. Those are things that are very helpful strategies with kids and with teens in terms of getting them to relax. I would say that with teens, they're probably a lot more savvy about finding the apps on their phone, such as Calm or Headspace, to help them. There are even podcasts that are out now that help individuals to just focus on their breathing and calm down. So we've talked about talking. We've talked about the gradual exposure. We've talked about the breathing, the progressive muscle relaxation. But another really helpful thing is positive self-talk. Now, what is positive self-talk? Positive self-talk is letting yourself know that you're going to be okay. Surprisingly enough, when people are in the middle of a panic attack, one of the most helpful things to do is to tell yourself that you are going to be okay. You can say this to your kids. You're going to be okay. You can do this. If you have a kid that doesn't want to sleep in their own bed, you're going to be okay. You can do this. It's encouraging. It's positive. It's letting them know they're going to be okay. One of the other important strategies is modeling. Now, what is modeling? If a kid is scared to, let's say, go on a roller coaster, you as the parent can't also be scared of going on the roller coaster. You have to show them that it's okay. See, mom is going to do it or dad is going to do it. We're going to go on that roller coaster together and we're going to be fine. That's modeling. And then another really common thing for kids is walking in nature. Now, why is walking in nature helpful? Well, one of the reasons why walking in nature is helpful is that you get to stop, you get to look at things, you're outdoors. It's also a safe place to be around other people because it's in the outdoors. So these are the strategies, just the helpful interventions that anybody can do. You don't necessarily need a therapist or a counselor to help with these things, but that is the anxiety what to do. Now let's move on and talk a little bit about strategies for social isolation. Now, it's really important to note that, as we mentioned before, COVID had a huge impact on our teens and our children. And so we need to really adjust our own expectation of our kids and our teens, set a lower bar for them. Now, what does that mean? What it means is that, a kid that was raised and started middle school during the pandemic is not going to be a kid that necessarily feels comfortable socializing in person. That's somebody that's going to have a harder time doing that. These are kids that are going to have a more challenging time with academics. So adjusting our own expectations is really important. As I mentioned earlier, modeling safe socialization is important. So if you have kids that are avoiding meeting other kids in person, they're avoiding going to parties, or they're avoiding going to concerts or going out to dinner, you as the parent have to show them that it's okay to do it safely, to do it and to do it safely. So you encourage your children to go out, you go to that party, it's okay. You encourage your child to come to the movies with you. We're going to go together as a family. It'll be fine. And if they're not able to do it on their own, then you go yourself and then you tell them about it. You say, well, we went out last night. We had a great time. Next time you join us. So you're encouraging your kids to leave their room. You're encouraging the kids to leave the house. And then you're also having those frank conversations with them about how you recognize how hard it is, that you understand it, that you're not telling them to do something you don't think that they're capable of doing. And so I think that it's really important that this practicing with kids, the modeling of the safe socialization, that's one of the things. Also, kind of as a side note, really setting your own expectations about social media use and how much time your kids are going to be on social media. Okay, so we have, I want to say, a good, at least a good 10 minutes here. We're going to take some time and talk about when do you need to seek out help? What are the types of help that's available? And what are the resources that are available? And if I have time, I'm also going to walk you through a specific example. So if we go back to the toolbox and what to do, some of these things you can do at home with your kid, and you might not even necessarily need a clinician to help with it. But sometimes you do. So one of the things that we look at as psychologists is something called functional impairment. And functional impairment is basically trying to make a determination of how long the behavior has happened, how severe the behavior is, and what are the different environments in which the behavior is occurring or taking place in. So that will tell us what kind of help the kid might need. So let's say, for example, you have a kid that has been refusing to go to school, and they haven't been to school in 2 weeks. And they are also refusing to go to their religious establishment, and they haven't seen any of their friends. We would call this functional impairment. It's pretty severe because they're not going to school at all, and it's happening in multiple environments, but it's only been happening for 2 weeks. So then we want to start to look at, why is the behavior happening? What's happening here? So we're going to look at all the different types of help here. And let's say, for example, this particular child, and I'm going to say this individual is like maybe 11. They go to, every time they're getting ready to go to school, they get nauseous, they vomit, and then they go back in their room and they don't get dressed and they don't go to school, and then the parents aren't able to get them to go. The very first intervention in that situation is you want to start with the family physician and say, okay, is there anything we need to rule out here? Is there anything happening that is leading this kid to have these physical symptoms other than anxiety? And so let's say the family physician, there isn't anything. And the kid has now not gone to school. It's been 3 weeks and the school is calling. The next level here is you want to go with the school counselor. So you want, as the family, want to come up with a plan with the school counselor about how to get this kid back in school, right? So let's take a look here at our toolbox. So one of the things that we're talking about here is relaxation and gradual exposure. Okay. So the gradual exposure to the feared event is school. They don't want to go to school. They don't want to be out. Um, this would be a time where you would want to start to intervene and have a therapist help out. The therapy could be an individual therapist. It could be a family therapist working with family. There could be group therapy. There are many different aspects to this, but you want a therapist on board to help develop a plan to get this kid back in school. Now, gradual exposure could take the form of saying to the kid, I understand that you are nervous and that you feel badly in your body. And today we're just gonna drive to school. You're gonna get dressed, you're gonna get yourself ready as if we're going to school, and we're just gonna drive to the school. That's the first gradual exposure. Then the second piece would be, okay, you did that. Now we're going to go into the school and we're going to sit in the counselor's office for an hour. And if you can manage that, maybe you transition into the classroom. But these are strategies that you probably would want to use the help of a therapist, because you want then to be having the kid practice some of these relaxation strategies. And you also want the therapist to help the kid to be able to talk about what is the feared event. Why is it that they're so scared of going to school? What is going on? And as we mentioned before, some of these issues really have to do with either the kid is being bullied, maybe they had a traumatic event happen at school and they're scared as a result of that. And, you want to get a sense of it. So looking at the different types of help here, we talked about the individual therapy. We talked about family therapy and group therapy. We talked about school counseling. And some things that we didn't really talk about were religious institutions, support groups, and mentorship. So some religious institutions actually have counseling available through them. And that might be an option if there is some discomfort with traditional type therapy. And it's also an option if there are financial limitations to consider. Some of the support groups that are out there are helpful and free. And then there's mentorship. Now, what is mentorship? Mentorship is like having a big brother, a big sister, or somebody that is older than the child or the teen that can be kind of like a role model for them and help them through certain situations. Now, mentorship, that is not a therapy situation. That you're not having a licensed professional there working with the individual. That is more of a supportive intervention. So moving on and talking a little bit about therapy for the individual, for the kid. When you're dealing with children, oftentimes therapy does involve the parents. Parents participate in the therapy. When you're talking about therapy for the teens, many times the parents are less involved. So one of the questions that comes up a lot of times for me as a clinician is, well, I would love to get therapy, but I can't afford it. Or I really want therapy for my kids, but I've not been able to contact anybody. Nobody seems to respond. And I just wanted to give you a few resources here that are resources in the community. And they are available through this PowerPoint online for however long this streaming is available. But basically at this point, the first resource here is the group list. Now, the group list is just basically that. It is a list of all the groups in all of Los Angeles. And so if you have a child that, you want an anxiety group, anxiety treatment group for them, this would be a place that you could look for that. If you are a parent and you're concerned about learning disabilities or learning issues, there's our groups for that as well. That's the group list. 2 online platforms for therapy that I wanted to give notice to are OpenPath and BetterHelp. And these are more cost-effective online therapy platforms. And I want to say that I'm finding in my practice, teens really do respond well to online therapy. And some kids do as well. Kids are able to do it. It helps them. With children I'm seeing, meeting in person is preferable, but kids are able to do it online, and this is a resource for you as a parent. And then additionally, looking up on platforms like Psychology Today, you can often find therapists through that as well. Now, some in-person therapy platforms, you have the San Fernando Valley Community Counseling Center, and that is a low-fee therapy center. And then you also have, that is in the San Fernando Valley. And then you also have the Wright Institute, which is on the west side. That's also affordable therapy. I mentioned here Tarzana treatment centers because I do know that some parents have children with substance abuse issues, who have teens with substance abuse issues, and that is also a resource for that. So, at this point in time, I am pretty much done with my presentation. I wanted to leave my information if people had any sort of questions or concerns. And I just wanted to reiterate that there is help out there, and that there are things that you can do as a parent to work with your kids. And I just thank you very much. Thank you.
Thank you. Thank you, Doctor. Thank you, Dr. Cochran, for your wonderful presentation and all the knowledge and expertise that you shared with us, specifically the strategies and resources that you offered with us. I think they are really priceless. And we all are somehow impacted by anxiety and depression in different levels, or at least we know someone around us that is. So I think, especially after the pandemic, so it would be wonderful that our audience share the video or the resources that you offered with others, so that they can benefit from this. And if we have, yeah, if anyone has any questions, let's see. I would like to thank you and thank our audience again for watching us. Until next time, hopefully.
Absolutely. I really appreciate the opportunity to meet with everybody. And as I mentioned earlier, I left my information. If there's any questions following the presentation, or if individuals are having any issues with the resources and are needing additional resources, please feel free and contact me by phone or by email, and I'm happy to respond.
Thank you so much. That's very generous. Thank you.
Of course.